The state legislature is in full swing, while drastic changes are slated for the federal government in Washington, D.C., with the Trump administration's cuts to the federal workforce and funding. Joining us now with his thoughts is Hawaii's Governor Josh Green. Aloha and good morning, Governor. Thank you so much for stopping by with us.
Thank you, Sam. Aloha.
So you just got back from Washington, D.C. at the National Governors Meeting, and you got to meet with the president. What were your takeaways?
President and his cabinet, it was quite extraordinary. It's important for me to go to Washington and see exactly what the landscape is, see what the cuts might look like, and express what I feel Hawaii needs to the president directly. He's making his large moves on DEI. What I explained was allow us to have ROI, return on investment. And he was very favorable, and his cabinet were very favorable to that opinion, because we governors need to sustain Medicaid and sustain our workforce. So much of it was extremely productive. We differ on a lot of things, but I'm going to try to find a path to help Hawaii.
You've wanted to bring in some federal workers that are released from the federal government into working for the state. How do you feel like that'll impact our state as well as our budget?
We are short 5,000 employees at the state level at least. So if there are cuts, and I have to say, what is happening at the federal level where the cuts from Mr. Musk are very steep and precipitous, that is hurting people, and I did express that I don't support that. But if there are people who separate from the Department of the Interior, maybe they can work in our Division of Land and Natural Resources. If they cut FBI or CIA workers, maybe they can help us in our Division of Law Enforcement. So we have a thing called Operation Hire Hawaii. Go to the website. People, if you've lost your job, we would like to hire people within 14 days to support our local people, our local workers. Again, sometimes tough things happen that hurt people, but maybe I can make lemonade out of lemons.
One of the president's financial plans is tariffs, specifically steel. Your focus is affordable housing, and then we also have the new Aloha Stadium Entertainment District project. How will these tariffs impact those two things?
Well, if the tariffs go into full effect, they could raise the price of timber out of Canada and also steel globally. That would raise cost for us. Right now, the president is using tariffs to tell other countries, you better comply with our immigration policy. And you saw a lot of those countries back down quite quickly. So I think a lot of it is a bargaining strategy. I did learn an incredible amount about the president and his team during my 4 days in D.C. So that's the strategy. I would like to make sure that our allies, people we work with, especially Japan and Canada in this case, can bring us low-cost fuel and low-cost materials, because we do have a housing crisis.
Something that's going around nationally, low vaccination rates, especially for MMR. We've seen a measles outbreak in West Texas, 100 cases there, about 16 people have been hospitalized so far. This is a small Mennonite community with a lot of religious exemptions for vaccine rates. How concerned are you with something like that happening here in Hawaii?
I'm concerned. As everyone knows, I spoke out pretty strongly against RFK Jr. We're seeing the manifestation of his misinformation campaign over the last 5 years really hit home, in this case in Texas. People don't believe in vaccinations. More people ask for exemptions for whatever reason, and then you see these outbreaks. 3 out of 500 people, mostly kids, who get measles are going to die. It will be tragic. And many more will have encephalopathy, which is damage to the cerebral brain tissue, which means they could have blindness or paralysis. So I'm passionate about this. I shared with the president that I'm going to try to work with him whenever I possibly can, but I draw the line in the sand on this. We will not allow our children to be hurt. Now, I know there's a bill being heard in the legislature. I want to tell everybody, I actually believe in religious exemptions, as long as they are legitimate exemptions that people believe deep in their heart. What happens, though, is a lot of people use excuses because they just don't want vaccinations. What I'm trying to do is broker a peace on the bill so that there can be an area where people get the exemptions, but the public schools have to be protected. Otherwise, we, like in Texas, will see those outbreaks. In one of those schools, one of those kindergarten classes, almost 50% of the people got religious exemptions. And anytime you get less than about 90% of a population getting vaccinated, measles crushes it. And remember, families with children under age 1 can't even consider the vaccination because it's not approved until age 1. So as a physician, and as the only governor who's a physician, I'm going to stand up for some of those issues. But I will work with anyone in the administration as long as it's helping people.
You spoke about the Department of Education. According to their data, about 1 in 5 kids has incomplete immunizations, and then there's been a doubling of religious exemptions. It's gone from 1% to 2% to 4%. As far as people who just believe that they shouldn't have to get vaccines for their kids to be in public schools, they say, we're going to have to leave Hawaii. What's your message to them?
There are a lot of options for people, but but we don't have the option of letting mass outbreaks occur. We saw what happens when there's a pandemic. It shuts everyone down. So we are a part of a society. We all have to behave as part of that society. But if someone has a health condition which prevents them from an immunologic standpoint from getting a vaccine, then I support them. If they have a deep-felt, heartfelt religious exemption for real, of course, okay? But a lot of people use the system and people use excuses, and that is human nature. I get it. So I have proposed some compromises to the Director of Health, and he seemed to like them. We'll see those in the coming weeks, I believe, if the bill goes forward. It's just regular information. As you see, the religious exemptions are just a piece of the reason people don't get vaccinated. Better information, health literacy, that's important. This is why RFK Jr. should not have been the health secretary. I would have supported him if he had been nominated for ag secretary or one of the legal team, because I believed in some of the things he was fighting for, like against pesticides, but he's a mistake for vaccinations and public health. It's just my role as one of the 50 governors to speak up, but especially for Hawaii. For Hawaii, I have to make sure our people are healthy and protected, and I'll do my very best. And I will be reasonable. For those who are more conservative and who are very worried about vaccinations, we can work on expanding the protocols. We can work on protecting your children with other means. But mostly, people please get vaccinated, because that's how we kept COVID at the lowest mortality rate in Hawaii. And historically, we are the health state. But it's teetering for a lot of rural communities, and that's what you're seeing in Texas.
Moving on, the State Salary Commission has proposed big pay raises for some state officials, including yourself. You talked about donating a big portion of your salary that will go up to, I think, 61% in the year 2031. With people struggling in Hawaii financially, cost of living, does it look bad for the State Salary Commission to promote these big pay raises?
I think they have to be more moderate. Honestly, what I have shared, and I want to share this very directly with you and everyone, I said, yes, you want to increase the pay, especially for the cabinet members and judges and legislators, modestly, so that we can attract great people. I have great people, but it's way less than the private sector gets paid in executive positions. For me, I asked them to keep the pay raises for myself and the lieutenant governor way, way more modest. I'm humbled to be able to be governor and to have a home that the taxpayers pay for. Anything over 5 or 6% increase that is kind of basic for society, I will donate to charity, just out of a sense of what's right and wrong. And I know it may be easy for me to say that, having been a physician and so on, but I'm going to make sure that I do what's right. I don't really have direct control of an independent commission, just to be completely clear, but I have told them, don't make it more than 5 or 6%, like you see in society, because people will be right to feel that that's unfair. And so that's why Jamie and I will give to our nonprofit, or give to homeless programs, or children's hunger programs are kind of an area of focus for the First Lady. That's where you'll see us giving any extra pay raise.
I think a lot of people will appreciate that. And Governor, if you got paid hourly, it might be even more than that. I know you just got off a flight to Washington, D.C., so appreciate you putting in all these long hours.
Thank you, everyone. I want people to understand the country's going to be okay. There's going to be a lot of negotiation on these policies, and I'm going to do my part to kind of make them go down the middle. And hopefully I'll be met with the same approach by the president and the cabinet. And I do have some confidence from this recent trip.
All right, Governor Green, thank you so much for stopping by with us this morning.
Thank you.
Aloha to you.